Hi, my name is Nikki Lee and I'm a lactation consultant at the Philadelphia Department of Public Health, and I'd like to take a few minutes of your time to talk to you about breastfeeding. How do you have a conversation with a pregnant person who's in your office or in your clinic? How do you have a conversation with them about breastfeeding when you yourself might not have breastfed? You maybe didn't have a good time breastfeeding when you had a baby for whatever reason. That doesn't change the fact that everyone that we serve at this health department needs to be thinking about the best ways to promote health in their lives. And breastfeeding is certainly one of those ways. Even during a pandemic, breastfeeding is still recommended by every major health organization in the world, including the Philadelphia Department of Public Health. Breastfeeding looks different for every family. Sometimes it looks like bringing baby to breast for every feed, and sometimes it looks like pumping and taking the milk out with a little machine called a breast pump and putting that milk in a bottle and feeding a baby that way. And most people in Philadelphia today find that they do a blend of both, especially when people go back to work after the baby is born. They find that they need to do both. So that's something that could be informative to the person that you're talking to. Let them know that there's many different ways of doing the best thing. Yeah, there's many different ways of doing the best thing. Breastfeeding can look many different ways, and there might be a way that it will work for them. It's also helpful for you to know that once a person stays pregnant for long enough to feel the baby moving inside them, that they start to make milk. And they don't have to do anything to make it happen. They don't have to read anything or eat any special food or do anything. That their body is just going to start making milk, and their body is going to make more milk after the baby is born and the placenta is delivered, and their milk volume is going to increase. And there's nothing that needs to be done to make that happen. It's just part of being human. So what needs to happen to keep milk going is taking it out. The person has to take milk out to make it. So why do we at the health department recommend breastfeeding to every pregnant family? Well, for one thing, it's for the health benefits. Breastfeeding is protective against breast cancer and cardiovascular disease and obesity and type 2 diabetes in the person who's breastfeeding. And for the baby, it lowers the baby's chances of dying of SIDS, of developing diabetes, of asthma and allergies, of lymphomas and leukemias. You know, it's really one of the best things we can do to get the new baby off to a good start to a healthy life. Breastfeeding is recommended by every health agency in the world, and right here in Philadelphia, every single birthing facility encourages families to breastfeed if it's their choice. So what does that mean? It looks like having policies and practices in the hospital and having staff educated to help get the baby going with breastfeeding as soon after birth as possible. So when the family goes home, they have already some ideas about how to breastfeed, and they've been doing it for a while. So Philadelphia's kind of got a built-in starting place in our entire hospital system. So letting people know that. You don't have to know anything about breastfeeding, but whatever hospital your baby is born in, there will be people there that can help you. A couple of other things that we do at the health department that are extremely helpful for breastfeeding families is we provide them with free help. And you'll see in this PowerPoint presentation, you've got some names and phone numbers. And the other thing that we do that's extremely helpful is we provide a free app that gives the breastfeeding person free video chat with a credentialed lactation helper any hour of the day or night, 24/7. And that's called the Pacify app, and you'll see a slide in this presentation about that. So there's no limit to how much it can be used. Somebody could you start using it now when they're pregnant if they have more questions, and then they might use it every day or 4 times a day if they need to. There's no limit. So this is another way that the Philadelphia Department of Health shows its commitment to the best health of mothers and babies. So thank you very much for your time. I hope you feel a little better having a conversation with a pregnant person in your clinic or your office. You don't have to be the one to help her breastfeed, but you can be the one to connect her with the resources to answer her questions and get breastfeeding going well for her and her family. So thank you very much.